Real news for Americans 50 plus. This is Emeritus News Channel.
Good afternoon, everybody. Today we're releasing new estimates, as we said we would. Last month we said we'd release estimates of the number of people made ill by, hospitalized from, and unfortunately killed by H1N1 influenza. It's 3 to 4 weeks later, so we're releasing those estimates today. And the bottom line is that by November 14th, the day up to which those estimates includes, many times more children and younger adults, unfortunately, had been hospitalized or killed by H1N1 influenza than occurs during a usual flu season. We'll also cover vaccine supply, which is expanding with increasing access in many parts of the country, and highlight that it is still a good window of opportunity to get vaccinated against H1N1 influenza. Tomorrow we'll provide the flu view update of what's happening as we do each Friday. It is likely to show that disease continues to decline as the current wave recedes. What will happen in the future? Only the future will tell. Flu season generally lasts until May, and as I've indicated before, when we've asked flu experts from around the country and around the world what they think will happen in the rest of this flu season, about half think we'll have a lot more cases between now and May, about half think we won't. The truth is we don't know. Only time will tell, and that's why vaccination remains the most important thing you can do to protect yourself and your family from H1N1 influenza. What we provided last month were the updates from April through October 17th. It's based on the best available data from multiple data sources. What we have seen so far reiterates that people under the age of 65 are most heavily impacted by influenza, that by November 14th, many times more children and younger adults, unfortunately, had been hospitalized or killed by H1 influenza than happens in a usual flu season. Specifically, there have been, we estimate, nearly 50 million cases, mostly in younger adults and children, more than 200,000 hospitalizations, which is about the same number that there is in a usual flu season for the entire year, and sadly, nearly 10,000 deaths, including 1,100 among children and 7,500 among younger adults. That's much higher than in a usual flu season. So as we've seen for months, this is a flu that's much harder on younger people and fortunately has largely spared the elderly until now. What that means, if you calculate it, is that about 15% of the entire country has been infected with H1N1 influenza, and that means about 1 in 6 people. That still leaves most people not having been infected and still remaining susceptible to H1N1 influenza. We also are releasing today information on the burden of influenza among the American Indian and Alaskan Native population. This is for 12 states where about half of the American Indian population resides. We find that this is in this week's MMWR. It finds that the death rate is about 4 times higher for this group. This is most likely largely a reflection of environmental factors and underlying conditions like diabetes and asthma that are more common, access to health care, rather than a genetic or race ethnicity difference. Since the beginning of the H1N1 outbreak, we've been aware of the potential for greater harm in populations with higher susceptibility, and we've prioritized vaccine, working with states to ensure that Indian Health Service and other facilities that care for American Indians and Alaskan Natives get enough vaccine and treatment, antivirals, early on to reduce the burden of illness and death to the greatest extent possible within existing technology. Vaccine supplies continue to grow, We added more than 12 million additional doses available in the past week. That brings us to 85 million doses of H1N1 influenza vaccine available. Many states have increased the eligibility, having met the demand in the 5 priority groups to the general population, and that's consistent with the recommendations of the Advisory Committee on Immunization Practices. So this is entirely consistent with what's been recommended. We've seen an increasing number of states do this, sometimes in individual communities or counties within states, sometimes in entire states. It's important, as they have been doing at the state and local level, to plan for that, to get vaccine out more widely to the retail pharmacies that can vaccinate, to a wider group of clinicians who want to vaccinate. Doing that has a lot of benefits. Not only does it enable people who want to get vaccinated, but because there are more providers giving vaccine, it increases the number of people in the high priority groups who get vaccinated as well. Since people with diabetes or lung disease go to pharmacies and go to their doctor's offices, and the more pharmacies and doctor's offices that have vaccine and can provide it, the more people at high risk as well as others will be vaccinated. This past week, CDC, consistent with policy where we're located here in Georgia, began offering vaccine to all employees, and I'll get vaccinated using the nasal spray vaccine in a few days. I, of course, will make sure that at CDC we continue to prioritize the high-risk groups, encouraging those with underlying conditions or who care for infants to get vaccinated in particular. This is still a good window of opportunity to be vaccinated. I can certainly understand that many people might say, well, there's been so much disease and it's going down so much, why get vaccinated now? But the fact is, we don't know what the future will hold. Just as in a usual flu season, you get vaccinated because you think it might be a bad flu season and the vaccine is likely to protect you. That's really the situation we're in now. We're at the beginning of December. Flu season lasts till May, and we don't know what the future will bring in terms of H1N1 influenza. We might have a lot more cases, we might have few, there's still spread going on now, and it's likely, if there are more cases, that it will be different in different parts of the country. It's a big country with different patterns of disease over this past season. So I hope that all who are interested in being vaccinated will be vaccinated. It's the best way to protect yourself and your family from illness, serious illness, hospitalization, or death. And it also, even if you wouldn't become severely ill, will protect you from being out sick from school or work for a week. The more people who are vaccinated, the more people who will be protected from influenza, the fewer cases we will have in the future, the less likely we will be to have a third wave or more cases in the weeks and months to come. Thanks very much, and I'll take questions starting in the room.
Hi, Dr. Mike Stobie from the AP. Thanks for doing this. 2 questions. One, could you tell us a little bit about what's going on with seasonal flu? Is that starting to appear more, and which strains of it? And also, you said you were going to get the nasal vaccine. Why nasal? I thought studies had shown it's the shot's a little more effective in adults.
So in terms of which formulation to get, I think each year the data will show in the end whether they're comparable or one is a little better, one is not. I've only got another year to get the nasal vaccine, so I figured I'd get it this year. Your first question was about seasonal. The FluView will provide that tomorrow, but basically we, until recently, have seen very little seasonal flu. We are beginning to see influenza B, as I have mentioned in the past. We did have a death in a child from influenza B. That is covered by the seasonal flu vaccine. We know that the uptake of seasonal flu vaccine has been fairly widespread, and that the supply is nearing its end for seasonal flu vaccine, but there is some still out there in some places.